Hey guys, and welcome to How to Gastro. In today's video, we'll be talking about pseudomembranous colitis, which is also commonly known as a C. diff infection. So let's get started. So what is pseudomembranous colitis? Pseudomembranous colitis refers to the swelling or inflammation of the large intestine, which is our colon, due to the disturbance of the normal bacterial flora of the colon and an overgrowth of Clostridium difficile, which is also known as C. diff. This infection is a common cause of diarrhea after antibiotic use. So the basic ideas we get from this definition is that pseudomembranous colitis is the inflammation of the large intestine, and this is due to a specific bacteria called C. diff or Clostridium difficile, and this infection actually most commonly occurs after a period of antibiotic use. So some things to note about C. diff is that it is found within 2 to 5% of the normal population within the normal flora of our colon, which means that it lives in harmony in our colon and doesn't produce any sort of symptoms or pathology there. But when we take antibiotics, the course of antibiotics actually change the environment of the colon and the normal flora starts to sort of fluctuate. So all the good bacteria start dying, and even though C. diff, when it's found there in a normal healthy patient, doesn't really cause a pathology, when we take antibiotics and all the other good bacteria start to die in that area, C. diff becomes more powerful and it's able to cause this inflammation of the large intestine. And that is why it's called pseudomembranous colitis. Colitis means the inflammation of the colon. So if you look at my picture on the right, you see our colon situated within our abdomen. And if we take a closer look at it, we see the patient is infected with a C. diff infection. You can see the changes in the aspect of the colon. We see these inflammation and eroded bits. And if we look closely, we can see under a microscope that it's actually caused by C. diff bacteria. So what are the causes of pseudomembranous colitis? The Clostridium difficile bacteria normally lives in our colon and is part of the normal flora. The good bacteria in our colon usually keeps the amount of C. diff in our body under control, but antibiotics can kill the healthy bacteria and allow C. diff to grow too fast. The C. diff bacteria give off a strong toxin that causes inflammation and bleeding in the lining of the colon. Any antibiotic can cause this condition. However, the drugs responsible for the problem most of the time are ampicillin, clindamycin, the fluoroquinolones, and the cephalosporins. So this slide sort of fixes all the information that I mentioned about a minute ago, explaining to you guys the exact way of how the C. diff infection actually comes about. So if we look at this little picture below, it talks about what C. diff does to the gut. And if you look at image A, we see 24 hours after exposure, the cells of the colon lining are normal. 30 hours after exposure, the C. diff toxin has started to damage cells, triggering inflammation and fluid buildup. And 36 hours after exposure, the inflamed cells can burst and die, and the C. diff spores leave the colon via diarrhea and await the next host. So another way this infection can actually spread is via spores in the fecal matter. And we're actually going to talk about that next. So let's go on to the next slide. So another cause of pseudomembranous colitis is healthcare-associated C. diff infection. Healthcare providers in the hospital may also pass the bacteria from one person to another. Because Clostridium difficile infection is spread by bacterial spores found within feces, the surfaces in a hospital may become contaminated with spores and spread via the hands of healthcare workers. So another way this infection spreads is by the contaminated surfaces of hands of hospital staff. And if we look at my picture on the right, you can see the C. diff spores here, and that is due to the patient not washing their hands after they've used the bathroom. Or if we look into the rural areas, it could be fecal waste getting into a water supply or contaminating fruits and vegetables or gardens. And this is all ways in which this bacteria can actually spread. Once the C. diff bacteria enters the body, it multiplies in the gastrointestinal tract and it causes the release of toxins that damage the colon and may lead to the pseudomembranous formation within the colon. So this is a closer picture of what the colonic aspect will become with a C. diff infection. So now let's talk about the microbiology of Clostridium difficile. So Clostridium difficile is a spore-forming, anaerobic, gram-positive bacillus. When stressed, these bacteria produce spores that are able to tolerate extreme conditions that active bacteria cannot. So again, remember we mentioned that when we take a course of antibiotics, most of the bacteria or the normal flora within our colon also become affected and are able to die out. But because C. diff has this coping mechanism or ability to produce spores that makes them very virulent bacteria, because they produce these spores, they're able to handle really, really harsh environments. And as we said, if our patient undergoes a course of antibiotics, the normal flora within the colon is affected. But because C. diff is able to produce spores, it's able to survive even in these harsh conditions in which the other bacteria die. And this is what makes it sort of the winner in this situation. So the C. diff may become established in the human colon, and it is usually present in about 2 to 5% of the adult population. The smaller number of healthy people naturally carry the bacteria in their large intestine and don't have ill effects from the infection. Pathogenic C. diff strains produce multiple toxins. The most well-characterized enterotoxins are Clostridium difficile toxin A and cytotoxin Clostridium difficile toxin B, both of which may produce diarrhea and inflammation in the affected patients. So in addition to being bacteria which are spore-forming, the actual signs and symptoms that appear in our patient are actually due to the toxins that are released from these bacteria. Once these bacteria multiply and divide more, they produce more and more of these toxins, and these toxins are actually the most destructive to the wall and lining of the colon. And this is why these patients develop this inflammation, erosions, and bleeding in the lining of the colon. So what are some signs and symptoms of a Clostridium difficile infection? Abdominal cramps, which can range from mild to severe, watery diarrhea, which is sometimes 5 to 10 times per day, bloody stools, fever, an urge to have a bowel movement, dehydration, because of course if we're going to have lots of watery diarrhea, our patient is going to go into dehydration, spasms, loss of appetite, and weight loss. So what are some tests and exams that we can use to diagnose a patient with pseudomembranous colitis? A colonoscopy or flexible sigmoidoscopy can be done, and this is actually the aspect that is seen on the colonoscope. We can also do an immunoassay for the C. diff toxin in the stool, or a PCR stool test, so a polymerase chain reaction stool test. There are also now new rapid diagnostic tests, and I've put an image below of what that looks like. So basically, a stool sample is added to a dilution extraction buffer, and we are able to put in a test strip. We wait 15 minutes, and we can see whether the patient is negative or positive for a C. diff infection. And of course, the blood test will show a high white blood cell count, and this is due to the inflammation process and infection with the bacteria. So how can one prevent a Clostridium difficile infection? In the Clostridium difficile infection, the leading cause of the disease is antibiotic use. Therefore, probiotic mixtures should be prescribed together with antibiotics to prevent the onset of pseudomembranous colitis. So if we take a probiotic together with our antibiotic, the chances of developing a C. diff infection are actually decreased quite substantially. And this is why most doctors today, when administering an antibiotic, will also administer a probiotic, which help the good bacteria or the normal flora of the colon to survive and live healthily in their environment despite the use of antibiotics. Hand washing in clinical practice, as well as washing fruits and veg thoroughly, is also essential. So remember again, we said another cause for pseudomembranous colitis was healthcare-associated C. diff infection, and this is where the hand washing is essential to prevent the spread of the C. diff bacteria from patient to patient or from different hospital surfaces to the patient, and as well as washing fruits and vegetables very thoroughly, especially in rural areas where there's no proper sanitation, and because this bacteria spreads by orophycal route. And finally, let's talk about the treatment of the disease. If an antibiotic caused the problem, the doctor may prescribe another antibiotic that can help the good bacteria grow back so the symptoms go away faster. These include fidaxomicin, which is Difficid, metronidazole, which is flagyl, or vancomycin. Electrolyte solutions or fluids can also be given if needed to treat dehydration due to diarrhea. And that brings us to the end of this presentation on pseudomembranous colitis and Clostridium difficile infection. Thank you guys so much for watching. Please make sure to like, comment, subscribe, and share. I hope you find these presentations very helpful and informative. If you would like to download a copy of this presentation, you can click the link in the bio. Take care and bye for now.